Welcome to A Healthy Dose of Humor, a podcast series that sets out to explore the intersection of humor and health. I've partnered with Leith, a creative agency with specialisms in advertising, communications, and health, to bring together patients, healthcare professionals, scientists, and advertising experts to debate and discuss all the ways that humor can help us communicate. So let's get stuck in. This episode, we are going to look into how humor has helped change behavior. Joining me today is Emma-Louise Fusari, a nurse with over 20 years of experience. Emma left the NHS to start her own health tech company, In-House Health, which works with SMEs and leaders using a clinically led and data-informed approach to establish and eliminate the root cause of work-related ill health. She was named Innovator of the Year at Computing's Women in Tech Excellence Awards for her pioneering health tech work. Also joining us is Sarah Welsh. Dr. Sarah Welsh is an accomplished medical doctor specializing in gynecology, obstetrics, and sexual health. She left the NHS to co-found HANX, a sexual and intimate wellness brand that was built with real bodies in mind. HANX uses humor and straight-talking language to break down barriers when it comes to taboos in women's health. Sarah has also taught as an honorary clinical lecturer at Imperial College, as well as leading sex and relationships education in UK schools. Also with me is Vic Milne. Vic is head of strategy at Leith and is very proud to manage a team of brilliant people with capabilities ranging from traditional brand planning to digital ecosystem modeling. In her 27 years in the industry, she has worked across a multitude of campaigns that range from selling cigarettes to detecting cancer early. Ooh, I wonder if there's a connection there. Thank you all so much for joining me. So, we are talking about the use of humor as an effective tool for changing behavior. So my question is actually to you first, Vic. Vic, have you seen humor help change behavior?
Yes, I think that you can see it across a number of, I'm going to talk a little bit about health, but just before I talk about that, there's lots and lots of subjects that humor is used to help change behavior. And I was listening to a podcast this morning, and I hadn't seen this ad when it came out, but Channel 4 did a sustainability ad about skid marks. Anybody see it?
So, I don't know. Do we want to clarify what kind of skid mark?
It was the people in power. So it was about the people in power and how a lot of the messages that we get as individuals are just do one small thing. You in your house, Emma, just do one small thing. And this whole ad was riffing on the people in power, the oil companies, the governments, ignoring their own advice. And it used a very provocative, puerile, visual idea around all of these guys dancing in their white pants with oil skid marks. Yeah, it's horrible. But the reason that they did this was so they could get people to change their behaviour other than changing their own sustainable behaviour, but actually to lobby and to speak to the people in power and to try to, what's the word I'm looking for, when you boycott certain organisations. And it was it's actually funny if you watch it. So it's Channel 4 did it. And what they found from that, it was discussed in Parliament. So it was using humour as a provocation to get people to change their behaviours. And it was very, very successful because if they hadn't done that, it wouldn't have been discussed in Parliament. So I wanted to just use an example of how the impact of humour helps us recall things a lot better. So it's the whole idea of not remembering what somebody's told you, but remembering how you felt when you spoke to somebody. And obviously, positive emotions have a more positive effect on your behaviours. So for instance, feeling pride in something you're doing rather than guilt or shame. And I think we see that in the evolution of behaviour change advertising, where we and brands have stopped trying to shock people into changing their behaviour, but have begun trying to entertain people into changing their behaviour. So if I get onto the subject of health, where this works is in prevention. Very well. So, for instance, in the Leith, we have done many, many years of Detect Cancer Early advertising for the Scottish Government. And I think every single ad, apart from one perhaps, has used humour. And the reason is that we know that by the use of humour, you are going to get better recall, you're going to get better engagement, but you're going to make people feel something, and it's a positive feeling, which is going to help them then change their behaviour. So an example would be, we did something way back, which was called the Poo Song, and it was about people trying to get people, but not just the 65 plus, although it's 50 plus now, I think, audiences to pop their poo in the post to get for bowel screening.
I mean, I'm already hearing the chorus in my head.
Yeah, pop your poo in the post.
Pop your poo in the post.
Yeah. But also those around them, their loved ones, their families, especially any kids. So the song wasn't aimed at kids, but it definitely was catchy. It was only in Scotland. So it used lots of different words for poo. Jobby.
It's one of my favourite words.
Yeah, I know. Jobby. Poo, all these different poop, all these different ways of talking about poo, and it was animated and it was just catchy.
You sure you don't want to sing it to us?
I can't remember the tune.
Oh, somebody must be. I mean, we're sitting here with nobody. You're going to have to drop we're going to have to drop the song into the episode or a link to it.
And it was an entertaining piece of film.
I mean, just to be clear, I don't think anyone listening, you can now pop your poo into the post. Enjoy the song, but don't just mail your poo to someone.
Oh no,
can I just say?
True. You got to.
It was a specific campaign to a specific address.
Yes.
Yeah, don't just put it in a jiffy bag.
No
jobbies in jiffy bags, please. Thank you.
It was encouraging people and their families to say, if you have somebody in your family over the age of 55, please tell them to do their bowel screening. So in Scotland, we would have all got, in fact, the day after my 50th birthday, I got my bowel screening envelope in the post. I know, I was like, oh. And it's a horrible thing. You don't want to be doing that. But so you leave it next to the loo and you ignore it. So that is the purpose of the campaigns of Detect Cancer Early, is trying to get people to change their behaviour by using a bit of humour. Equally, if it's check yourself for cancer, for breast cancer, we've used humour in the past for that, also for lung. And I think for health, it's very acceptable in prevention to go in with humour, because you are trying to change people's behaviours, therefore to get them to have better survival rates or to detect cancer early.
So what we're finding is that humor is more effective in changing behaviors and using it in these campaigns, because we're taking these sorts of behaviors away from shame or away from fear, and we're putting them into an acceptable place, because humor is, of course, socially acceptable, isn't it? It's something that we share. It's rare to be humorous on one's own, but when it's a shared experience, then it's much easier to then go, oh, that's my sister's poo cup, because she just turned 50. And everyone goes, oh yeah, I remember that song.
Mm-hmm. I think it's aligning it with a positive feeling rather than a feeling of shame or fear, because, well, it gives you resilience, humour, doesn't it, a little bit. It makes you feel like you've got a bit of an armour or something like that, so you can do more difficult things, perhaps.
I think that's something that's really special about preventative health campaigns, like as a woman and the rise of female commercialisation. Everything is around you're not good enough, or you're ugly, or you're too fat, or you've got stretch marks, so buy this cream. And actually it's negative emotions that are making us consume and buy things. So health can actually say, this is not your fault. There is more than just you that's experiencing this, and it can help people engage better in that positive advertising rather than the negative that we're so familiar with.
I think it's a very astute distinction to make, is the difference between health advertising and beauty advertising or commercial advertising, is you're saying that whereas so much of commercial advertising often plays upon our insecurities in order to get us to consume, you're saying that the freedom of health is that let's use humor to say, listen, you're human, so look after yourself as humans should.
Yeah, this can happen to anyone. It's not your fault. It's not something you've done or caused, or you're not the only person experiencing this. So speak to someone, or find the advice, or reach out to your GP, your doctor, your nurse, healthcare professional. But do something and don't ignore it.
Right, because let's be honest, everybody poos.
Yeah,
don't they?
Once in a while.
We've really gone to the world of poo, haven't we?
Yeah.
In the first 12 minutes. I started on skid marks. It's my fault. But what I think that a good example on here, and it's not directly related to health, but it is related to safety and behaviour change, and that's the Grands in the Car adverts that we did for Scottish Government in terms of trying to get young men who felt completely invincible in their cars to drive more safely for the behalf of the rest of the population, because what we found was, and it's not going to be a surprise to anybody, but young men who'd not long passed their test felt completely invincible once they were in their cars, and therefore acted in a way like nothing could hurt them. But what we found, or one of my colleagues found this beautiful insight in the research, was, I think this one guy said, the only thing that would stop me is if I had precious cargo. And automatically the researcher was thinking, well, a child, or your girlfriend or whatever. But where we got down to was, no, their grandmother. So they would never want to A, see their grandmother harmed, or B, be seen to be behaving irresponsibly in front of their grandmother. So the whole concept is about a load of young people in a car, driving irresponsibly, and then all of a sudden the grand's head pops out of the glove compartment and, starts giving him a wee bit of a row, saying that if you don't, behave better in this car, then you won't ever get my mince and tatties again, or whatever. So the humour comes off of a really strong insight, but it is executed in a way that is like surreal and ridiculous. So that it would really, be retained.
That's really interesting. I think we do want to explore a little bit more about how to incorporate humor into campaigns. But before we do that, I want to stick with health and ask you, Emma, do you think that therefore, because we were talking about health in terms of preventative behavioral changes and going and just doing things that will help people before they get to a point of needing further help. But do you think that humor is only reserved for specific therapy areas, or can we use it in a wider range of places?
I think humour is universal, therefore it can be applied in many different situations. And it goes back to there are lots of variations. So it depends on the individual, the patient, the environment, the reason why they're there, etc., as to when you would apply it. So I don't think there's one specific area that it can or it can't be used, but it depends on the variables that would present itself, particularly at that time.
Emma, do you think that humour is deployed specifically more taboo topics, taboo areas?
I think it's easier to apply it to taboo subjects because there is a lot of social norms out there that we either want to encourage or discourage people behaving in. And I think that means that you can take things that are traditionally or typically taboo to a different level and we want to reach those people because it is taboo rather than just something that everyone's already talking about. It doesn't make it stand out anymore, whereas we need to reach people with more taboo subjects. And a campaign I seen last year, I'm not sure if anyone seen it, and it was around pelvic floor exercises as an example. And it was kind of around the behaviours that women can do pelvic floor exercises without anyone noticing them. And a lot of the videos were like, face pulling and things like that because we think we're not doing it. I bet you all tightened your...
I think I remember, we all do. It's an automatic. But I remember that campaign as well where they kind of... They'd sit there and
and what I loved about that specifically was the hashtag, which was Dry for Christmas. And I just because we've got Dry January, etc. And I just found that really good. And I think that's the ability now of modern day technology, is that we can gauge whether campaigns are actually working more. And I believe there is a research paper coming off the back of that 3-month campaign on using humour within that. I think it was Bournemouth University, so do check that out on the results from that campaign. It was December 23, I think it finished. So, but yeah, I think Taboo makes it easier to attack it as a humorous campaign than perhaps we don't really need to tackle things that aren't taboo because they're not taboo and people already talk about them.
Yeah. Right. And so humor's that icebreaker, just make it that little bit easier. I think that's a genius, combining pelvic floor exercises with Christmas. As a wife and a mother, I certainly clench a lot at that time of year.
It should be with sneezing, more like hay fever time. Pelvic floor.
Do you think, just quick question, do you think there are any untapped areas that humor might be? Is there any area that we haven't really used humor to crack open yet?
I think there's a time and place for humour, and the ones we haven't tapped into, perhaps we've not evolved yet in using humour as regularly as we should as health campaigners. I think if health is introduced more into campaigns, then we can probably penetrate some more difficult areas. But at the minute, I think as a nation, we're probably not ready for some of the darker areas to be humorised as such. But once we start taking the nice, bright subjects and taboo subjects, we can start moving into perhaps some darker areas and integrating some more humour.
Okay, so what you're saying is we want to see more health campaigns generally.
Yes.
And just as a population get used to seeing that sort of advertising.
Yes.
Before we start really honing in on some of what you say is darker.
Yeah, some more like scary or not so nice areas. I think there's a place everywhere for humour, but we're not, as a nation, we're not used to humour enough in health campaigns to accept it and engage with it in more difficult areas.
Well, I think that's a perfect segue for me to turn to Sarah and say, Sarah, given that we've explored that we'd like to introduce humour into campaigns, I think the question for you is how? What would you say to more brands looking to incorporate humour to help change behaviour?
Yeah, I think what we found, we want to allow our community to advocate for themselves, and being specific, being straight up, not, dodging difficult topics, and also acknowledging that you're never always going to get it right. So listening and being empathetic and actually understanding where you've gone wrong as well. We use humour a lot. We do talk about sex and pleasure a lot. And again, like you were saying, Emma, the kind of taboo areas are a little bit more accessible to use humour. And there's a lot of myths and misconceptions in sexual health and female health. So kind of unpacking that with humour and campaigns that use humour. But just listening to your audience and understanding your audience is also super important. We're all human, so having that human touch works really well for us.
Well, actually, what sorts of things has your audience taught you with regards to your use of humour in your awareness campaigns?
Yeah, I think we always want to ensure that we're speaking, not on behalf of people. So ensuring that we are working with people that have lived experiences and things. I'm trying to think of campaigns, but for example, we were talking about UTIs on TikTok and getting UTIs in the most difficult, ridiculous scenarios at a festival or on a date. And because we have medication that supports with that on our pharmacy arm. So we were talking about this, and then in a humour, in a funny way. And then we had someone that it didn't land with, and they kind of messaged us and said, look, this hasn't landed with me right. And we're a bit offended by what we were saying. And I think, we're not going to be right for everyone every time. So just understanding who we're talking to, who our audience is, and also being aware of any backlash that you might get.
Can I just add, I think backlash is sometimes good because people talk about it, and it kind of, obviously you don't want everyone complaining, and you things getting banned. But when people are talking about it or tweeting it, and whether it's good or bad, I think when it comes to health, there's not as such a thing as bad publicity, because what we want to do is raise awareness. So if things don't land and people are like, oh, have you seen that? Well, they're showing it to more people, and that's a positive thing from a health campaign perspective.
And I think it's to do with, I think when it's somebody individual and you received that email, you're going to feel as a brand responsible because perhaps that was an advocate of yours or something like that. However, in the wider world, when people are complaining about things, often they're complaining about things on behalf of others and not really from their own lived experience as well, which means it's just less applicable. And you've done your work, you've researched it. You're not going out to offend people. You're not saying something grim. So if people are offended, it's their sensitivities, I guess.
100%. And that's not something you can change overnight. And I think building that connection over time with the community helps with that. But yeah, I completely agree. I
think that's part of the challenge with offence, is that when it comes to health, people do come with their own experiences, their own traumas, whether it's personal or through relatives, etc. And that's, we can't just listen to one person and then change a whole campaign. And as long as we know that what we're doing is with integrity and good intent, then there will always be people that are offended. But actually, it's about the messaging and the purpose behind what we're doing it.
So it sounds like you're all pretty much agreeing that one complaint is not enough, or we have to investigate that complaint and see where it's coming from. Do we prioritize a lived experience over an adjacent experience because they've been near to but not gone through it themselves? How do this is I suppose as interesting as how do we do it right, but what do we do when it goes slightly wrong?
I think that we can't invalidate anybody's experience at all, whether it's adjacent, whether it's lived, whether it's just somebody that you know or whatever. So there's nothing invalid with people's opinions. But I think as a brand or an institution going out there to make a point, unless it has wildly off the mark, I mean, it's really, really offended people, and we can understand and agree that actually we overlooked something or something was overlooked, I think that you do need quite a groundswell. And also for advertising, there's an awful lot of regulation that you have to go through anyway before anything goes out there. So you've got to go through, if you're on broadcast TV, you've got to go through Clearcast, you've got to go through Ofcom and Advertising Association. So there's lots of checks along the way. That's not to say that sometimes you can get it wrong. And then I think to both of your points, it's just about being human about it, even though you maybe are a brand. What you don't want to do is hide the comments.
Exactly.
Which so many people do.
Yeah, no, I completely agree. I think responding to the comments and showing and being open and having that warm-hearted approach to these different experiences is definitely the way forward. And we found that, and people really respect that in our community. And then that builds trust and that connection. And then you have more authority to use humour.
Yeah, I think where I see it go wrong is sometimes where a brand tries to be funny and it's not in their brand values or guidelines, and the messaging's all wrong. And you can just think, it might be just a bit too corporate, for example. Yeah. So it needs to be, it's just like, like what you've got, Sarah, that's just kind of something you've evolved from the beginning, but it's always been part of your values in engaging people in taboo subjects.
Definitely. And I think consumers aren't fickle, and, people can see through things that aren't authentic when a brand speaks in a way that's not true to themselves.
I suppose the key is authenticity, which is what you said, Sarah, because in fact, I can think of many situations where a brand that does take itself very seriously suddenly engages in humor, and we actually love it. I mean, the first time Robert De Niro played a comedy role, everyone went, oh my God, it's the best thing ever. We love that he doesn't take himself too seriously. So there can be huge, positive effects to a brand taking itself less seriously, but it still has to be done with authenticity.
Yeah. They have to have a place in the conversation or be invited to the conversation in some way, rather than sort of dad dancing into it and saying, oh, everybody's talking about this, I'm going to get in on it. They need to be part of the conversation.
Can I just say, though, I think that would be a fantastic cervical smear awareness campaign, is if they're all talking about it and dad dances in and goes, what are we talking about? I want to be a part of this conversation. I would find that hilarious. I would definitely.
Okay.
Yeah. I would recommend.
I'm just
I would
taking
just
a
say,
note.
make a note.
Yeah,
whatever
dancing.
the dad dancing in and wanting to join in. What are we talking about? We're talking about starting menstruation at 13. Okay, great. Dad's dancing out of the conversation. Yeah. Thanks for joining, Dad. I think that's actually very funny. So in summary, what I'm hearing is that, first of all, we have seen, I mean, as you said, Vic, humor is a very effective tool for behavioral change. And we've seen this again in the health campaign arena, where we're using it as a means of opening up a topic of conversation, shedding a little bit of light on slightly more taboo topics, and just making it more comfortable for people to actually engage in those preventative behaviors or those behavioral changes that we want them to engage in for their own and for their family's sake. When we look at in health and in humor, using humor in therapy areas, generally, we're going to come across it in all areas, as you said, Emma, although there are certainly still some darker areas where we might not go straight away, but we're going to build, as the public becomes more aware of health campaigns and what their purposes are, and as we widen out the topics that we're covering, hopefully we can eventually get to those what are seen as more darker places with humor, with effect. But obviously, the aim isn't to end up there. I think that unlike in comedy, where sometimes we go, ooh, how can we make a joke about this dark topic? In health campaign, it's about being effective. And we might still agree that humor might not be the most effective way for certain areas. In terms of how to incorporate it into campaigns, I mean, we've seen this with great effect with your company, Sarah, HANX, and you use that in wonderful ways. And the way to do that, if you've never used humor in a campaign, is to do your research, speak to your audience, but also listen to your audience and hear what they're saying to you. And if it should go wrong, if someone does say, excuse me, I think you have hit the mark, the answer is not to shut it down, but to actually engage in that conversation. Because as they say, no publicity is bad publicity. If that's going to spark a conversation in the comments, as we said, then do engage in that, because that might in the end help build the trust that you have with your audience to be able to then get it right the next time. Thanks again for joining me on A Healthy Dose of Humor. And remember, if you're interested in hearing more about the topic of health and humor, or connecting with any of our series contributors, you can access all of that and more at leith.co.uk/healthydose.